morning, everybody. My name is Jody Hanson. I'm the Director of Public Affairs and Communication for Johnson County. We have with us today Dr. Sami Ariola, who is the Director of Johnson County Department of Health and Environment. We also have Elizabeth Holschuh, who is our Director of Epidemiology, and Becca is providing our ASL interpretation. So thank you all for being here this morning. Dr. Ariola, I thought maybe you could get us started by just talking about plans for the week.
Thank you, Jody. Good morning, everyone. This week, our schedule remains essentially similar to what we have done the past few weeks. We had clinic yesterday from 9 a.m. to 3 p.m. and walk-ins up until 2:30 p.m. Same today. If you have an appointment, it's either it will be from 9 to 3 p.m. If you don't have an appointment, but you have the time to go get vaccinated, you can walk in up until 2:30 p.m. Tomorrow, Thursday, we'll have clinic from 3 p.m. to 7 p.m. and also clinic on Saturday from 8:30 to noon. And so still multiple opportunities to get vaccinated. And as a reminder, other partners are vaccinating. We know, especially Children's Mercy Hospital has been focusing on vaccinating in our younger age group, and Elizabeth can provide a little bit more insight shortly. Our health systems are vaccinating. Primary care physicians are vaccinating. Pediatricians are vaccinating. Pharmacists are vaccinating. Just lots of opportunities to get vaccinated. And we are beginning to really expand our community clinic effort and have several programs that are being planned. And so again, just confirming what we are finding, which is that still a lot of people out there who wants to get vaccinated, and maybe the mass vaccination clinic is just not convenient, maybe because of work or other considerations, or maybe they're just like me who don't go out of my way to get things like that. So we want to make it easier for you. We are talking to our cities. We are talking to different community planners, and our staff are really engaged. Again, later today, we are finalizing a few of those plans just to make sure that everything is ready to go. Goal remains the same: provide multiple opportunities for our residents to get vaccinated. Still a lot of people out there that wants to get vaccinated, that needs to get vaccinated, so we can again inch closer to that population immunity. That's really our goal. And I was looking at the numbers today, and Elizabeth will also talk about numbers. Our incidence rates been encouraging, really dipping further down. And across the country, it's pretty similar. Across the country right now, a few weeks ago, we were still averaging 80,000 cases a day. Right now, it's under 20,000. All of those are encouraging that even 3 weeks after the change in the mask guidelines for those that are vaccinated, that our numbers are still looking good, which again is emphasizing how good the vaccines that we have are working. And we will even get better, which gets us closer to where we want to be. We can get the vaccine into the arms of even more residents, and across the country get more people vaccinated. So that's our plan. It's very similar to what we've been doing: get people vaccinated and get people tested as appropriate also. And those opportunities are many this week as and we expect the opportunities to continue to be around. And so, Elizabeth, if you want to talk about other activities around vaccinating our adolescents, but also talk a little bit about the numbers. Yeah.
Absolutely. Thank you, Dr. Ariola. Good morning, everybody. As always, Wednesday is the day that we get our data. So this week, the data I'm talking about is from last Wednesday. So stay tuned later on today for updated numbers. But Dr. Ariola is right. We continue to see increases in our vaccination coverage, and particularly these 12 to 18-year-olds who have been most recently added to be eligible for the vaccine to that 12 to 15-year-old age group. So we continue to work very closely with Children's Mercy to advertise their clinics. In fact, they have one this afternoon from 2 to 6 p.m. at their Children's Mercy Kansas campus. And we're also working with our schools. As you know, they're all out for the summer, but summer activities still continue. And so it's very important for us to continue to work with particularly our coaches who have weight training and conditioning over the summer for their fall sports events. So we're working with them to try and advocate for them to be proponents of the vaccine for their students. You know, vaccines continue to be one of the best ways both to protect individuals from the disease as well as family members and community members. But also, you know, when we think about keeping kids in activities, we saw in the spring and the fall a number of students who weren't able to complete athletic seasons, compete in their big events because they've been exposed to COVID. And when somebody is exposed to COVID, if they are not vaccinated or have not been infected recently, so within the last 6 months, they have to quarantine, which means that if they're supposed to be at home at that time for that one big sporting event, they are unable to participate. And so we saw teams have to end their seasons early. So the best way to keep sports going, to keep these kids in their activities, is to vaccinate. Because once they're fully vaccinated, and so it's going to be 2 weeks after that second dose of Pfizer, and if they're exposed, as long as they don't have any symptoms, they are able to continue to participate in all of their activities and events and hang out with friends without risking spreading the disease to anybody else. So it's a really big piece for keeping kids involved. As for our numbers right now, according to our data from last week, we have fully vaccinated approximately 44% of our eligible population. So those are going to be 12 and up. CDC, which has more real-time data, as well as is able to incorporate data from other states. So for people who maybe got vaccinated in Missouri or in other states, they're showing that we have actually about 56% of our eligible population is fully immunized. And again, their data gets updated more regularly, so we'll see what today's numbers hold. And as for what we're doing in the community, we are, you know, you're going to see us in the community a whole lot more. You hopefully will see our presence, and hopefully in particular around those places where young adults are. They continue to be an age group where we don't see as high of an uptake. And so we're talking 20 and 30-year-olds, which kind of makes sense, right? They're busy, they're working, they have social lives. And so maybe making it to our Lenexa clinic or to the pharmacy to get vaccinated has not really been a priority. So our goal as we move forward is really to meet people where they are. So even tomorrow night, we will be in Mission at the Running Well store on Johnson Drive with a free vaccine event. So if you're in Mission and want to stop on by, or even if you want to drive into Mission and hang out, we'll be there offering free vaccines. And so it will be a great opportunity for us to get into the community and really try and provide vaccine where people are, which is where we are in this response. We've seen our appointments drop off in our vaccine clinics, but we have lots of opportunities for people to walk in. But now it's time to get people vaccinated without really making them go out of their way to do it. So we're excited as we move into this new phase, and hopefully we'll continue to see our numbers increase.
Elizabeth, that's a perfect segue. We have a reporter with us, Jacob Martin from the Shawnee Mission Post, who had asked if we're doing any mobile or pop-up vaccine sites for young adults. If so, what will that look like? Where will that be? So you mentioned one, the Running Well store. What are the times of that clinic?
Yeah, absolutely. So we will be there. Let me pull up my calendar from 5 until 7 tomorrow night. So on the 3rd. And so what it'll be is we'll be likely outside. There will be hopefully a sign that says we're doing free vaccine events. It isn't just people going to the store. If anybody else who's in town, who's walking along the street, who's driving along and sees our sign and wants to get vaccinated, absolutely come on by. Again, completely free, no cost to anybody. And it's a great opportunity. And you know, particularly if you live in Northeast Johnson County and you don't want to come down to Lenexa, maybe this is a perfect chance for you to get out. I haven't checked the weather, so I don't know what that will look like. But yeah, so we will be doing more of these. I believe we'll also be in Mission again next week, doing another event. So stay tuned for other opportunities. And we'll also be continuing to talk about this on our weekly press conference, as well as on social media. And some of your favorite stores, you may see them pop up if you follow them on social media, where they are advertising that we'll be there.
And we would provide more information later this week about the different events planned. And several weeks ago, our epidemiology team took on, because many of them are in this age group that we are targeting, they took on the challenge of looking for opportunities to take vaccines to our young adults. And they have done a tremendous job. We are going to release a comprehensive list of the activities that we have planned, and keep adding to those lists as more activities are planned. So really impressive. They have identified good locations where young adults congregate. They have looked into events that are being planned, so to have those opportunities. There's some that also we are planning with different cities, like Overland Park or later, where activities where we get to meet not just adults, but they're 12, 13, 14-year-old perhaps playing sports or doing some other activities. So again, expect a lot more information this week and next week that provides more specific information about where we'll be, when we'll be there. And of course, that list will not be exhaustive. We will be adding to it as we finalize things. Also remember that we have the event planned in June, a couple of days, Saturday and Sunday, where we're working with a group of churches and to vaccinate. But again, the next few days will provide more detailed information about those that are coming up. So.
And I just had a question and it just escaped my mind. So you're talking about these different community clinics. So social media will be a good place to watch those. Oh, I know what I was going to ask. What if somebody, whether it's a business or an organization, wants to request that you come, or I have a favorite store that I think would be a great place to attract young adults? How do I reach out to the health department?
I'll let Elizabeth take that. Go ahead. Yeah.
That's an excellent question. So you can do that a couple of different ways. One is we have a form on our website that if you're a business in particular and you want to see if we can come out and vaccinate a number of your staff or have a store or something like that, you can absolutely feel free to go onto our website and fill that out. The other way you can do that is to email us at jcdhe@jocogov.org and let us know about your interest. We have a number of staff who are excellent at planning these events and can work with you depending on the number of people we think will be there and what our availability is. But really, this is how we think that we can get to that finish line that we keep talking about of population immunity, is by, we may not get a lot of people. It may not be 300 or 500, but, every 150, every 200, every 50 people who we can get vaccinated are 50 people or 150 people closer to where we need to be. And that is truly how we are going to be able to prevent COVID-19 from transmitting through our community and making people sick. Unfortunately, as great as our numbers are, they are at the lowest levels we've really seen in a very long time. Unfortunately, we do keep seeing people hospitalized. We are still having hospitalizations and some deaths associated with COVID-19, and pretty much exclusively in our unvaccinated population. So we know that COVID-19 can be deadly for people, and the best way to prevent severe hospitalization, death, all of those pieces is through vaccination.
Another reporter, Jacob, is asking another question. There's been a message, or there's been mention of a text message-based service via cell phone that might offer vaccination sites close to individuals. Can you provide more details on that? A text message-based service.
I think those exist. Maybe I'm assuming they're talking about the CDC side, but we're not currently doing that locally. But if you use the CDC site, you can see local clinics that have appointments. Right now, it's virtually everyone has appointments. You can see where the vaccination sites are, but we are not currently doing that.
And again, I would encourage people, particularly parents of the 12 to 18 population, if you're uncertain, or maybe you want to potentially go to your pediatrician, give them a call and see A, whether or not they are carrying the vaccine, and B, if they aren't, see if you can have a conversation if you're still concerned. The majority of pediatricians are, completely understand. I saw something this weekend that said, I'm a pediatrician, and I have, a 12 and up, and I have already gotten them their first dose, and I have kids who are younger than 12, and I'm counting the days until it's available, right? This is the way for us to get out of COVID-19, to protect our kids. And even though they don't have as severe complications, we have seen kids hospitalized due to COVID-19 from our own community, both due to that original illness, the initial illness, as well as due to what we call MIS-C, or the multi-system inflammatory syndrome in kids. I know that Children's Mercy has had a number of hospitalizations due to COVID-19, particularly at the peak of the pandemic in the over winter. So it is not something that, these kids can completely come through unscathed. Some kids are still having these sort of long COVID symptoms. So continuing to have some weakness or fatigue or headaches and other symptoms associated with it. So would definitely recommend you ask your pediatrician if you're concerned. If you have a family physician as your primary care provider for your kids, definitely check to see if they have Pfizer. Some family physicians are only carrying either J&J or Moderna, which are not yet licensed for those younger age groups. So reach out to your provider if that's something that would make you feel more comfortable about either yourself or your child receiving the vaccine.
We have a question on Facebook that I'm just going to ask a piece of. Somebody was wondering, what are the benchmarks for federal funding to end? So maybe a way to broaden that question is, what benchmarks are there maybe for us to know that this pandemic is over? And I know we're not there yet, but what are we looking at?
So like we have said, there are many factors that are being looked at. The population immunity, numbers for quote unquote established illnesses, we have better idea. We know that for polio, that's around 80%. For measles, around 95%. For this, we're not so sure because it's relatively new. But we are beginning to see the impact. We are seeing sustained decrease in the number of cases as we get into the 60s in terms of vaccination. I think it will even get better as we get more people vaccinated. So right now, the best estimate you've seen, very wide estimate over time, 70 to 85%. That's again because of the uncertainty about the new virus. There's also the consideration of people that are infected. They have some measure of immunity. Now, our recommendation is that they get vaccinated. We know the immune response from vaccine is a lot higher than you would from natural infection. So I think the benchmark to look at is, can we keep the numbers low? Can it keep going down? And of course, the key benchmark that is also consistent with that is the percentage of people that are vaccinated keep going up. So if we don't have an escalation in terms of the number of cases, and of course, our hospitalization metrics are very important. I saw, you see numbers nationally, death numbers, hospitalization numbers, and locally here are way down. Those are the metrics that we're looking at. Can we keep them down? We still have this concern, of course, that we have with the variants that are here. But the more that we're getting people vaccinated, the more that we are, at least in the United States, not seeing what could potentially, in theory, happen with predominant with this variant circulating being the predominant species. We're not seeing those, telling us again that the vaccine is working. You look at the UK, which is giving about 70% of their adults at least one dose of the vaccine. You see the same trend. You see the cases are down. You see hospitalization and deaths down. That's what we are seeing here also. So those are the many factors that are being looked at. But I think the best number is vaccination rate. Let's keep getting the vaccine to the arms of people, and we will be watching this pandemic, this virus, this infection, not just mitigated but contained. When we get to those sporadic, when we get to only having sporadic cases, and it's Elizabeth and our team that are just investigating those and keeping them contained, we will know that we're getting to a place where even the virus, when it's making contact with 4 people, 3 of them are roadblocks because they're already vaccinated. That's where we want to get to.
Great. Well, thank you so much for sharing such great information today. I wanted to see if either of you had any closing remarks before we wrap up this morning.
It is Wednesday, lots of opportunity to get vaccinated. Elizabeth mentioned the event in the community tomorrow. We talked about that clinic today, tomorrow, and Saturday, and that's just from the health department perspective. Like we've constantly said, this is about the local public health system. We're just so blessed in our county to have so many opportunities to get vaccinated. We're also blessed to have Children Mercy Hospital, who has taken it upon themselves to vaccinate. When children did not qualify for this, they were vaccinating in groups that will allow children to be healthy, children to stay in school, children to stay at their childcare establishment. They are vaccinating. They are leading the efforts in the adolescent group, age group. So go get your child vaccinated. So when they go to that travel club and playing soccer and playing basketball, you're not worried about their safety. You're also not worried about them infecting other people. So if you have questions, we're always available to answer your questions. Thank you.
Great. Thank you so much, Dr. Sami Ariola, Elizabeth Holshoe, Becca, our ASL interpreter. Thank you all for being here this morning. Thanks to the members of the media who were a part of this and those of you watching on Facebook. Thanks so much, everybody, and have a great rest of your day.